Right. So the paradox about lying is that lying is considered an undesirable behavior. We really don't like people to lie. This is a, a phenomenon across all cultures. We rate lying as a pretty negative behavior, and we don't like people to lie to us. Honesty is highly valued. Um, all cultures value honesty. And the reason that we really don't like it when people lie is because it seems a violation of trust. It's a violation of trust of the relationship between people. And it harms as a result our social relations, and it can lead to loss of credibility. If you are caught as being a liar, labeled as a liar, you lose credibility. People don't trust you anymore. Yet the paradox is we still tell lies, at least time to time. And it can be a social strategy we use to maintain and negotiate our social relations. And in fact, lies can even be told for pro-social reasons. In fact, when we look at the sort of lies, they kind of fall on what I would say is a spectrum. On one end, you have sort of more antisocial lies. These are lies told to protect or enhance the liar psychologically or the liar's interests. So these are much more self-serving. So, did you eat that cookie that I told you not to eat before dinner? Oh, no, I didn't eat that cookie. Or an adult lying on their tax return in order to get a bigger rebate or to avoid paying tax. On the other hand, they can be more pro-social in nature. These are lies told to protect or enhance another person psychologically or their interests. So they're more other-oriented. So, politeness lies, for instance, like getting a gift that you're like, oh, I don't like this. I didn't really want this, but oh, thank you so much. I love it. That's a politeness lie. Lies can even be altruistic, lies that are told at potential cost to oneself, but are of great benefit to another. So, for instance, during Nazi occupation, people who lied and concealed Jews, they were doing that at potential cost to themselves, potential they could get in a lot of trouble and discovered, but they were doing it for the higher sort of virtue of justice, of preventing, their friends, their neighbors, their from being, taken and killed. So we can actually tell lies for even altruistic reasons at times. Although generally, we think of lies in the more antisocial vein, and we really do not like people to tell those lies. Oh, so if we go here, so the next question is, do children tell lies? And then how do we examine lie-telling behavior? I'm just going to spend a little moment on that because we do a lot of research in this to empirically look at these questions. But it's actually a really difficult behavior to examine because it's a private concealed behavior. When you lie, you don't go, oh, by the way, I just told a lie. You don't raise up your hand and alert everyone to know that you told a lie. The point of telling a lie is to get away with it. So it's private and you're trying to prevent detection of that lie. So you can't just go to a playground and observe children lying or go to a mall and observe adults lying. You have to know what ground truth is, because someone could tell a lie and if you don't know what the truth, what actually happened, you wouldn't know necessarily whether they were telling a lie or not. Also, we don't want to create situations where we instruct the person to lie. Okay, now you tell me a lie, because although we have parlor games like that, in reality, when people lie, they're spontaneously making the decision to lie. And they're not, they know that the person that they're lying to, they're trying to prevent that person from knowing that they're lying. So if I tell you to lie, then it's becomes somewhat artificial. So one of the ways that myself and other researchers look in this is we use sort of different scenarios. And one of the most commonly used one is one that I started using over, I guess, 20 years ago, which is the temptation resistance paradigm. And here's a picture of it. So you have in this picture, a little boy, and he's sitting at a table with a researcher, and his back is to the researcher, and she's bringing out different toys from a bag of different toys, and each one, if you squeeze it, it makes a noise. So this one, you squeeze it and the baby makes a crying noise, and the children ask, okay, can you guess what that is? And they guess based on the audio clue, and then they get to play with the toys. And we have usually in that bag we have a range of different toys that children like, different characters from different TV shows and things like that. And they all make noises, and they get to guess what it is. So like it might be Elmo, and Elmo giggles, and they guess that it's Elmo. And we have different toys for different sort of ages. So they play that, and they play that several times. And then for the last one, the researcher has to go out of the room to get some papers, and they tell them, remember, you're not allowed to peek. And they leave the toy on the table, but this time the audio clue is something totally unassociated with the toy. And so they can't guess based on the sound. And then they leave the child in the room to get the papers. And while they're gone, a hidden camera captures what the child does. And the child has been told not to peek. So you're going to see now a 5-year-old. Hopefully this is you're going to be able to work this video. And you'll hear right at the very beginning of this video, you hear a click because the researchers just left the room. And you'll see what this boy does. So you see very soon, within like less than 10 seconds, he turns around and he pats the toy and he looks at it. So what we find actually is that in this situation, in the age ranges of like 7 and under, the majority of children, this is quite tempting. They're really curious. This is a fun game for them. They're really curious what the toys are. And, about roughly 80% of children in this study peeked at the toy out of curiosity. And that's why it's called the temptation resistance paradigm. It's really highly tempting. So having done that, the researcher comes back in the room, and having covered up the toy, says, when I was out of the room, did you peek at the toy? Did you look at the toy? And so children are asked whether they peeked or not. And then afterwards they're asked, well, what do you think it is? And why do you think it's that? Because if they say they didn't peek, but then they guess what it is, what is their explanation for knowing what the toy is? Because we know that the audio clue has nothing to do with the toy. So we want to see not only will children lie about peeking, but also how good are they at giving a plausible lie, whether their subsequent statements stand up. So, okay, in this study, 82% peek. Did children lie? Yes, they did. So when they were asked, did you peek? You see that the majority of children actually lied about it. And it was about 80% of children in this study. And that range varies between about 70 to 80%, depending on your on the study and the cohort, but the age range, it decreases as they get a little bit older. So it's not as high, the lie rate. And you'll notice that there's a significant difference between 3-year-olds and the older kids, with only about a third of the 3-year-olds lying. And that's something that's consistently been shown here in Canada and in other studies around the globe, that there's this difference between about 3 and 4. Children are only just starting to lie around 3 years of age, and not all of them are telling lies yet, but by 4 years of age, most children are telling lies. So what did this little boy do? So you're going to, so the researchers come back in the room, he's covered up the toy, and and in fact, in this one, before he even gets an opportunity to ask the question, the little boy blurts out an answer of what he thinks it is. So you're going to see what this little boy said.
We can't hear the video, Dr. Talwar, so I don't know if you shared the sound.
I'm being told you can't hear the video, so I'm so sorry about that. Maybe the sound didn't get shared. I don't know what the settings are. So then you can't hear what he said. So what he said, I'll tell you, is that he said, I saw it was, so the researcher asked him, did you peek? He says, no. And he says, I saw it was, I saw, and then he thinks, oh no, I can't have seen it. So he says, I saw in my mind that it was a dog. So he tries to save it there for why he thinks it's a dog. So so that gets to lie telling skills. So just because the child lies and says that they peek doesn't mean that they're a good liar. Are children successful at telling convincing lies? And to be a convincing liar, you need to be able to regulate your expressive behavior, your nonverbal behavior, so facial expressions and bodily cues. You don't want them to arouse suspicion, and we call that nonverbal leakage control, but also your verbal expressive behavior. You need to make sure the content of your verbal statements do not contradict your initial lie. We call that semantic leakage control. And what we found was when we showed videotapes of the children answering whether they peaked or not, we showed these to both undergrads and parents, not parents of the children, but other parents who might have more experience with children. And we find that both of them were at chance levels. They were not good at detecting and distinguishing the liars and the non-liars. And interestingly, we did find, though, that they were more likely to rate boys as being lie tellers than girls, even though we found actually no difference in the rate of lying between boys and girls in this study. Notably, this is not that surprising because in the subsequent, so this paper was 2002 that it came out, and so much research has come out in the last 2 decades that show meta-analyses that actually, in reality, we are really bad at detecting people's lies. Adults are bad at detecting others' lies at a rate of 54%, and we found that the same rate is for adults detecting children at around 54%. So we're not good at detecting lies. Okay, so just because we're not good at detecting lies does not mean that they weren't doing something that could be actually detected. So we actually coded their nonverbal behavior to see if they were doing anything that would give away their lie. And we did find that the liars in this study had a bigger smile. So did you peek at the toy? No, compared to the non-liars who had more relaxed mouth. But the thing to note here is we coded for about 36 different nonverbal behaviors, and we only found a couple of significant differences. So there really wasn't a lot there. And the thing is, although we found big smiles, I've done many studies now, and big smiles is not a reliable cue that you see across all lie situations, or even every time with the same child. So the thing to know is when it comes to the proverbial Pinocchio's nose, the sign that you can always know that someone's lying because they have a tell that tells them. Wouldn't it be nice if you just knew your child was lying just by how big their nose got? Well, there is no Pinocchio's nose, and there is so much research behind that. And so I know there are people out there who give webinars and all sorts of things about how you can, detect a liar and these nonverbal signs, but that actually is a lie. There is no Pinocchio's nose. So, but can children lie tellers conceal verbally? Well, in actual fact, what we found was when we look at their verbal answers, that's when you're much more likely to detect them. Young children are poor lie tellers, and they actually have difficulty maintaining lies when asked follow-up questions. They often blurt out things that, like, when we first did this study, Barney was a really big thing, and we put out the toy Barney, and then I come back and I say, "Oh, what do you think it is?" And they'd be like, "Oh, Barney." "How did you know it was Barney?" "Because I saw the purple dinosaur." And you're like, "Well, I thought you didn't peek." So young children are really poor at maintaining their lies, and this has been reliably found with us and with other researchers around the globe. And it's not till you see they're getting to about 8-9 years of age that they get sort of, by 9 years of age, they're about at 80% are able to maintain their lies just in a few questions afterwards. So what about pro-social liars? I talked about we can lie for antisocial reasons, but also pro-social reasons. So what about telling a polite lie? Well, so for this, we use what we call the disappointing gift paradigm to look at this. So would you rather have a nice, colorful slinky that you can have fun with? Or would you like to have a bar of Lysol soap? Well, we did a study where children did tasks and they told that they could get a gift, a prize at the end of it. And they either got a slinky or a toy, or they got a disappointing gift, which was a bar of soap. And what you see in this graph is you see we left them, the reaction time was we left them to open up their gift. The gift giver gave it to them and left the room. And so they were in private. And you see here the child's like, ugh, I got soap. Why did I get soap? And so you see they didn't have very much. The red line is the undesirable gift. They don't have much positive affect, as you see with this child. But then the gift giver came back in the room and said, oh, do you like the gift I gave you? And suddenly we see this red line shoot up for that question. And we would see children go, yes, thank you for the gift. And we found that older children were more likely to come up with plausible reasons why the gift was, they liked the gift, what they would use the gift for, etc. Whereas younger children, would just say yes, but they couldn't really elaborate on that. So all of this in this development, we see the fact that it starts to emerge in the preschool years, lie-telling behavior, that they're not very good at it when they're young, but as they develop, they get better at lie-telling, is related to children's emerging cognitive development skills. And so a lot of research is shown, and there's meta-analyses that just came out that show this effect across many studies, is that it's related to theory of mind. So that's understanding others' mental states of others, understanding that you can create a false belief in others, that other people have different thoughts, beliefs, and knowledge from yourself. And it's also related to executive functioning. In particular, research has shown that it's related to inhibitory control. You need to suppress, your expressive behavior, suppress what actually the truth, and kind of make sure you do everything that's consistent with this lie. Working memory, you have to keep in mind what you initially said and make sure everything sort of is consistent. Planning ability and also cognitive flexibility have also been found to be related. In fact, and this relates to some children who have different sort of cognitive profiles, such as children with autism. And in fact, so what has been shown, documented with children with autism or with individuals with autism, is that there's this broad pattern of reducibility and reduced prevalence of deception. So this is being clearly documented that, there's less likelihood and there's less prevalence of lying. And honesty is often described as a characteristic of autism. And there have been some studies, a dozen or more studies that have done looked at autism with children, and also there's been studies with adults. One study that I did was we looked at children who had autism compared to some control children who did not have autism. And we found that when we put them in that temptation resistance paradigm with the Peking game that I told you about, we found that children with autism had a lower likelihood of lying than the control children. But notice that still some of those children lied. So it's not like they completely didn't lie. But when we also looked at the ability to maintain lies, we found that children with autism were not as skilled at maintaining their lies compared to the control group. Other research has also found that children with autism may be less likely to detect lies in others or deceitfulness in others. So this is a study where they did, they had children with autism and also control, and they played a game with another person who they were told this person was quite tricky, and this person didn't want them to win the prize. And so they would play first the trust task, where there would be stickers or a prize put in one of 3 boxes, and this tricky person would look in all the boxes, and then they would point to one of the boxes and say the prize is in here. And if the child opened that box, they would discover that the prize wasn't in there, and they would lose it, and the other person would get the prize. But if they looked in they didn't trust that person, they looked in one of the other boxes, they would win the prize. And so they did that to see how long the children realized this person is not to be trusted, and I shouldn't look at the box that they are indicating where the prize is. They then wanted to see whether the children would, having interacted with this tricky person, whether they would then retaliate when we reversed the game and they were the one hiding this prize and they were the one indicating where the box is, whether they would point to the box where the prize was and let the tricky person win the prize, or whether they would point to another box so that person would look there and they would get to keep the prize. And what they found was children with ASD were more likely to trust the other person even after being deceived. So you see in the graphs here, they basically failed to distrust the tricky confederate. So even over many trials, they continued to trust that person and they kept on losing out on the prize. And they also, in the deception task, when they could deceive, children with ASD were less likely to deceive, and they continued to point to the right location. So what this study and other studies that I don't have time to go into, but what they're showing and suggesting is that children with autism below 11 years of age, at least, may engage in some deception, but it may be less. So there may be some that don't engage in deception. There may be some that engage in some deception. It can vary. But when they do engage in deception, they may be also less successful at maintaining that deception. And there's been two suggestions in the literature about this. One is that they don't always maintain appropriate facial emotion. They kind of give it away by like smiling or showing something that is incongruent with whatever their lie is. And they're also not good at maintaining their lies verbally. But there is a lot of individual variation. And this may be due to verbal ability, to theory of mind ability, to executive functioning abilities. But what it does speak to is also the fact that they don't often, they may be less likely to understand that people can be deceptive to them, is important given that they have already increased vulnerability for bullying and exploitation. So they may not always understand that others could be potentially deceptive. And so helping them in terms of social cognitive training and understanding social motivational context is important to help them start to understand that others can be deceptive. Also, some research has suggested that actually gameplay deception can help children with autism start to understand deception, and that deception can be used as a strategy. If children with autism are lying, then, just like you, with any child, you want to teach them about the importance of honesty and giving them consequences for lying, and also, sort of praising and teaching the value of honesty. And we'll talk more about that in a bit. Another group which also has a different, has problems often in executive functioning, is children with fetal alcohol syndrome. And this group is sort of the opposite of children with autism, in that lying is often reported as being a problem behavior. So anecdotally, there's a lot of reporting of children with FASD lying. But there's really been very little research with this group. I actually worked with a colleague in the University of Alberta, and we actually did one empirical study with these children. And we found that children with FASD lied at higher rates than children without. And you see that in particularly with the preschoolers, they're lying earlier and more likely to. So this suggests that we can see some empirical evidence beyond the anecdotal evidence that this is a problem, but we need a lot more research in this area to fully understand the behavior in children with FASD. There have been a couple of suggestions in the literature. One may be that they may be lying as a strategy to conceal their discretions due to their low impulse control. So they're getting themselves more into sort of scrapes and getting themselves into difficulties or transgressing. And then they're kind of using lying as a sort of band-aid solution to try and mitigate those the consequences. Also, there's maybe some evidence anecdotally that they also have problem with confabulation. So confabulation in someone with FASD is caused by damage to the prefrontal cortex. And this causes the person to believe in sort of false memories or perceptions. So they have difficulty distinguishing with what actually happened and what they kind of thought or imagined happened. So they need to help to children with FASD, you need to help them learn to distinguish what is like accurate and what is inaccurate information, learn to distinguish, can this be verified? Is there some evidence for what I'm saying, kind of thing? Also, the other thing is to reduce their cognitive load, because it's suggested that, because of their difficulties in terms of executive functioning, instead of asking them things like, did you do your homework? You could ask them, show me your homework, which kind of reduces the cognitive load and less likely for them to confabulate, say, well, I wanted to do my homework. I must have done my homework. I did and then saying, I did my homework. You still just, as with other children, you're going to, when they are lying and not confabulating, and it can be quite difficult sometimes to determine if they're confabulating or they're lying. But if you believe that they're lying, they're actually intending to deceive you, as opposed to getting it mixed up in their mind. It can, you want to discipline them. And, in terms of probably controlling their environment, so that they're less likely, and creating conditions where they're less likely to act up, which also will reduce the likelihood that they are lying. So the paradox of lying is that it appears to emerge as a part of a normative part of children's development, and this emergence and development are related to their cognitive abilities. But before I go on, I want to talk about like how big a problem is this in society as a general rule, because sometimes people get really alarmed about lying. And certainly if your child has told you a lie, you can get really upset because it is a violation of trust. But we have to keep it in perspective that people will tell occasional lies. And what do adults do? Well, a lot of research has, and you'll see this in the media, it gets quoted all the time, because a lot of research suggested we tell 1 to 2 lies a day. So you think about that. What lie did you tell today? Maybe you can think of a lie you told today. Apparently you told 1 or 2. Well, at some point, some people say, well, I don't think I lied today. Well, the fact is that that may be actually a little bit misleading. So Sirota and Levine did a study where they actually asked 1,000 adults. The first study they did in the US, and then they repeated this in the UK. And they asked them how many lies they told in the last 24 hours. And they found that of their 1,000, they had 1,646 lies were reported being told in the preceding 24 hours, which is an average of 1.64 lies a day. So that's that 1 to 2 lies. But if you look at this graph and you look over here at the A-year occurrence, you'll see that actually when they looked beyond the average and they looked at the distribution, they found that actually 59.9% had told no lies in 24 hours and 40% had told lies. So this 1,646 comes from these 40% of their 1,000 people. And then when they looked here, B is the number of the lies in the past 24 hours. The majority of these are really 1 to 2 lies. From this 40% are telling 1 to 2 lies. But then there's a few that are telling a lot of lies. And in fact, what they found was that 5.3% of the sample told 50% of the lies. So 50% of this 1,646 came from just 5.3% of their population. That's 53 people told an average of 16 lies each in the 24 hours. So you can see that's a pretty skewed number. So what the research is now showing is that when you look at the skew, people do lie. So if you change this to 24 hours and you said in the last month, most people will have told 1 lie, maybe 2 lies. They'll have told a few lies. But people are lying on occasion. It's not necessarily a daily basis kind of thing that people are doing, but for a very small percentage, they're lying, they're prolific liars. They're lying a lot. So how big of this problem is this? Well, the fact is for most adults and most children grow up to be these adults. It's an occasional behavior. So even if they go through a period of time and there is like children as they're trying to test out boundaries, they might go through a period of time where they're like, okay, can I lie about this? And they're learning about it. They eventually, for most, it just it kind of settles down into this occasional behavior. And the data suggests that it's only a small percentage of adults that frequently tell lies. What about children? Well, it's hard to tell because a lot of this depends on who's reporting. It's sometimes the mother that's reporting, sometimes it's teachers that are reporting, or sometimes it's adults that are older and they're remembering for when they were children. And the range has been anywhere between 3 to 23%. However, it looks like it's likely, you know, similar to adults, maybe a little bit higher. One study that had really large groups over time suggested at 7%. So it's still not a huge amount, but it may be a little bit higher in the childhood times. So in terms of there are different trajectories of lying. So you can see there are, some that are really prolific liars. There's in the literature suggests about pathological lying, where you're kind of lying because almost like individuals who it just becomes habitual. They don't want to lie, but it kind of becomes their go-to strategy that they do so easily. Situational liars, where you're not generally a dishonest person, but suddenly you get yourself in a situation that forces you into lying a lot during a certain period in your life. You get into embroil something with a friend, and you find you have to cover up for the friend, and it's making you lie when you never did before, for instance. Occasional liars, which most of us lie in, occasional lie. And then there may be people, presumably if there are prolific liars, though it really hasn't been tested in the literature, but I assume that if we have prolific liars, we probably have people who are very honest and never tell lies, but they would be a very small percentage, again, of the population based on the data that we've seen. So the other thing to know about lying is sometimes part of something else that it's bigger. It's sometimes not its own behavior, but it's part of a bigger problem. Lying, for instance, is related to conduct disorder and oppositional defiant disorder, which I'll talk about in the next slide. It also can be related to school problems. A child who's having school problems, it can be for a variety of reasons, may engage in lying as a concealment behavior. It can be related to maladaptive behaviors, such as, various disorders like eating disorder. Youth that have eating disorders and adults who have eating disorders can conceal and lie to continue doing their maladaptive behavior, to continue to not eat or to throw up if they have bulimia. So they use lying as a way to continue those behaviors. It's the same with substance abuse. They may lie to conceal their substance abuse, and gambling as well, so that they can continue with this behavior. Lying can also become a problem for some children and youth when they become part of a deviant peer group. And what do I mean by that? I mean a group where lying, they may have to lie to conceal the types of behaviors they're doing. They may be doing illegal things or things that would get them in trouble, some sort of transgressive behaviors, or it's part of the code of that deviant group that you kind of lie and don't let other people know what you're doing. And so it may lead to it being a problem behavior as a result of membership of that group. There are two disorders in childhood that are deceitfulness is kind of like a core component of. In fact, in conduct disorder, it's actually part of the diagnoses. Children with conduct disorder showed callous disregard often for others' feelings. So they may lie and be aggressive without and find that potentially quite useful for what they're trying to do, and they show a sustained behavior. So part of to be diagnosed for that, they have to show sustained behavior over time of aggression towards others, destruction of property, deceitfulness, and theft. So it's right in the diagnosis, and serious violation of rules. Oppositional defiant disorder is when they show extreme behavioral issues for more than 6 months that include anger, irritability, arguing with authority figures, refusing to follow rules, deliberately annoying people, blaming others for their mistakes, and being vindictive. And lying toward authority figures can be a feature of this oppositional defiant disorder. And for both of these, in terms of treatment, it needs to be treated beyond often, the home, you need to have psychotherapy and behavioral therapy for a sustained amount of time, as well as family and parental support. For parents, you need support to help you on how to encourage the desired behaviors and how to communicate with the child, and set clear expectations and praise them so that they'll follow through. And so this needs to be worked on. So some of the things we're going to talk about today are useful for parents with children with conduct and oppositional defiant disorder, but on your own, I would still encourage you to work with a therapist through on these issues and about honesty with them beyond just sort of some just generalized tips, because you need to really work as a kind of a holistic therapy with your therapist and your practitioner. Another one is attention deficit hyperactivity disorder. And anecdotally, parents report that children can lie about things with ADHD, like their homework or concealing things that make them look bad. And this may be due to lack of self-control or delayed executive functioning development. They may be, with their ADHD difficulties, they may resort to lying to cover them up. But I would say that it's not well documented in the scientific literature empirically. So you may see more frequent lying exhibited in some children with ADHD. It's not a core component of this, and I don't think not all children with ADHD have lying as a problem behavior at all. And in fact, what the prevalence of this would be, we have no idea. So we just know anecdotally some parents do report it. For instance, children with ADHD may use lying to mitigate negative consequences of their symptoms. They may try to appear in a positive light. So for instance, they could lie about doing work or chores. And when you ask them, did they put away their toys? They may, and they actually haven't done it, they may stubbornly insist that they did it. And this may be that they're telling a lie, but it also may be that they've forgotten that you told them to put it away, and they're like, no. Or alternatively, they got distracted and later lie to mitigate the blame. And so we need to realize that sometimes they're lying as a result of the child's inability to manage their ADHD symptoms. And so they often really need help. Not only you need to teach them that lying is wrong and there are consequences for lying and that honesty is valued, you also probably need to help them in their environment, structure environment, and help them to manage their difficulties and their symptoms. And work through those, because they might be lying as a way to sort of mitigate the consequences of those. Another one is malingering. So this is lying for some sort of external incentive or gain, and children can malinger for a wide variety of reasons. Some examples are children malingers to avoid school because they're socially isolated, they're bullied, or they're having difficulties. The child can lie about a parent dying because they feel neglected or they're seeking attention. A child could fake a learning disorder to get more time on exams. Youth could avoid punishment by pretending to be unfit to stand trial because of mental illness, or the youth could seek admission to a hospital to obtain a safe place with free room and board. So really it's based on lying for there's some sort of gain, external gain. And often malingering is, in the literature, is often noted that it's often in adversarial contexts. The personal stakes are usually high for the individual who's lying, and they perceive that they have no other viable alternative. So what should you do? Well, if you think lying is a problem, then seek help. When you see it as a repetitive and persistent pattern of time. So a child lying to you once is not yet a time to be concerned. And as you saw I showed you when they showed the temptation resistance paradigm, the Peking game, children will tell little fibs, and it's pretty normal. So it's not something to get upset with right away, or to think your child's a bad child, or they're going to, this is a terrible thing that's happening. But when you see it as a repetitive and persistent problem, then that's time to seek help. And so that means seeing frequent lying without a clear cause or nor discernible reasons, repeated or unbelievable, fantastical lies, repeated lies that place the liar in a favorable light, in reputational lies, frequent talk of grandiosity, lies to manipulate or control others, a pattern of lying that's just steadily getting worse over a period of time, over a number of months, lies told with other behaviors also, so aggression, intense rage, extreme mood swings, or lack of concern for others' feelings, or continuing to lie even when it's negatively interfering their social relations and they can't seem to stop. The other time that you should lie, the other time you should seek help is when, if it, even if it's developmentally appropriate, the cause just occasionally fibbing to you, it may lead to really negative feelings and impact parental coping. So if you're having serious or ongoing difficulty coping with your child's behavior, you don't need to struggle with that alone. You can seek help. And you can seek help. You can go to a school psychologist, you can go to a therapist, a pediatrician, a counselor, and ask for a referral. And you can seek help, family therapy, parent training to help you with some ways to cope with the child, cope with the child's behavior, or psychotherapy can help. So if you're struggling and are having difficulties, then that's also a reason to seek help. We all are, I think it's something that all parents do struggle from time to time. And if it's really having a really negative impact on your own mental health, then you should seek help. I know we're on terms of time, so I have a few tips for raising truthful children that can be applied to children. Any child who, that you want to teach them to be honest. So we want to talk to them and teach them about the value of honesty, and not just when they actually lie to us, but at other times. So you can talk about, these can be conversations about your child's behavior, about your behavior, about other people's behaviors. Moments of honesty arise throughout our days, and you can have formal teaching about honesty, but you can also have these informal conversations when you notice moments when someone is honest, and you just label it or reflect upon it. Like, you're at the grocery store and the man in front of you gets extra change from the clerk and says to the, oh, you gave me too much change, and hands back the extra change. And you can say, oh, that man was being so honest. He gave back the change, just reflecting on it. And you can have a conversation then, or you can just label it. But moments like that draws your attention to moments of honesty in their world, realize they start to notice it and realize that people are honest in the world. But also you can have conversations. Why was the person honest? What else could the person have said? Why is that important? Why is that good? They can start reflecting on this importance of honesty and why we value honesty, and so they can start to understand it. And one of the best ways to have these conversations, one of the best things you can do as a parent, is read stories to your child. You can read, just start up the habit of reading stories with them from the youngest age. In the youngest age, you can get, Sarah Boynton books, which just have the rhythm of the language, and they love the rhythm of the language. They respond to it. But by having that sort of habit, it gives you a connection time with your child, which is really special. It's really important for your bond with your child. It helps them with whole lots of academic skills by reading to them. It helps them understand other people's perspectives. It helps them to start understanding emotions and feelings as you talk about the characters and why they behave like that. But these are also really good jumping off points to talk about different topics like honesty. So they can show in the characters, the characters can model to them how it is to be honest about something that you could be dishonest about. And they can see the positive consequences that for the characters when they are finally honest. If they've initially been lying and then they're honest, they can see that. And these can be powerful messages for the child. And you can get different developmentally appropriate books. And when children get older and they're not reading, they're reading their own books even, you can still be reading with them. You can have books that you share together. Maybe, Harry Potter, you share that together, or they're reading it and you ask them about it. You can talk about the characters. Harry Potter's full of characters who are being deceptive and other characters who are being honest and good, and all sorts of different things. And you can talk about those and have more nuanced conversations with older kids about the characters and honesty, and when someone may choose not to be honest and why did they choose not to be honest, sometimes for good reasons, sometimes for bad reasons. And we've done research on this. So we did research with different stories that we often tell about honesty, such as the Pinocchio story and the Boy Who Cried Wolf, and also the George Washington, the cherry tree. In that story, George Washington cuts down with an axe a cherry tree of his father's, and later his father asks, "Who cut down my cherry tree?" And George says, "Father, I cannot tell a lie, it was me." And his father, although not happy about the cherry tree, is proud of him for being honest and telling him the truth. And so we showed this as well. We read these stories to children before they were in that temptation resistance paradigm. And we also had a one condition where they had just a control story, which was the tortoise and the hare, nothing to do with honesty. And what you see is that you had similar rates of lying about whether children would lie about their own transgression, except for when they had heard the George Washington story, when there was a significant decrease in children's rate of lie telling. And we've subsequently done other studies with stories. And what we found was that basically stories that model how to be honest. So for instance, the George Washington story, he did something wrong. He cut down his father's cherry tree. So he had transgressed, but then he owns up to his transgression. Owning up to your transgression, you have to remember it's not an easy thing to do. So seeing someone do that models that for you, and then to see that there were positive outcomes is a very powerful message. So reading stories to children, asking questions about the story to help them reflect and understand about that can be really an effective way that you can help them learn. Have a conversation with them, not a lecture. So if it's right after your child lies, keep it brief. Just give them a reminder about the importance of honesty. You've hopefully been already having conversations about this. And then know that your child in that moment might be quite defensive. They may not want to be ready to own up to their lie, for instance. So don't get embroiled in it. Just deal with the situation there. Later, at other times, you can take more time and have a discussion and ask questions, and know that the child will be more open to discussion and questions at that time. The other thing is we want to reinforce honesty. We need to catch them being honest. Too often we only deal with dishonesty and have conversations with them when there are violations. But if we are saying honesty is really important, then we need to notice it and give it some appreciation. We have to give it some credit. So when children are honest, you can acknowledge it. You told the truth. You can show appreciation. Thank you for telling the truth. You can show praise. Good job telling the truth, even when it was hard. It isn't always easy to be honest, and it isn't always the easiest way out. It can be easier to lie about that transgression and maybe get out of trouble. So we need to give it credit when we see honesty and notice it. How you are also impacts your children. How you behave sends important messages to your children about what you're saying. So if you say honesty is important, but then you model lying, then you're teaching children, okay, lying in general is a good policy, but you can fudge it when you want to. It suits your purposes, your own personal gain. You can just fudge it a bit. So if that's not what you want to teach your children, then you need to make sure that that you're careful about what you do and that you are behaving honestly. You will have a much more powerful effect on your child's behavior when your deeds and your words align. So we need to, as parents, walk the talk. Also, when we are dealing with lying, we need to discipline calmly. We need to deal with our emotions and calm ourselves down and be able to communicate calmly with children. It's okay to feel like upset when your child lies to you. It's pretty normal because it is it feels like a violation of trust. But understanding now, you've understood the development line, you realize that maybe your child isn't there, it's not so unusual, and it's natural part of childhood. And keeping that in mind, you can calm yourself down and realize that you just need to deal with the situation now, with them, and that try and look at the underlying motivation. What did they lie about? Why did they lie about? And address that underlying emotion, and then you can discipline the child appropriately. The other thing is not to set them up, particularly with young children. So for instance, if you, the wall scribble, you come in, the child's scribbled on the wall, and you say, "Did you scribble on the wall?" Well, now you've given them the option to lie, and they may try and lie to please you. "Oh, I don't want to be the one that mommy doesn't like because I scribbled on the wall." "No, I didn't scribble on the wall." And you've made your job harder, because now you have the transgression of scribbling on the wall and the lie to deal with. So instead you can say, "I see you drew on the wall. The wall is not for drawing on. Here's a cloth to clean it off, and we're going to talk more about, not drawing on the wall." So you're dealing with the transgression. So not setting them up is also one that we need to not make our lives more complicated by asking them things where we already know the answer. Or like the example before, like, "Did you do your homework?" And you know that the child struggles with that, or they might confabulate. You can say, "Show me the homework." We have to make the consequences proportional to the crime. So it's kind of like the speeding ticket idea. Sometimes people will not reduce their speed unless there's a fear of getting a ticket. And for some, knowing they can get a ticket is just enough. For others, they need to experience. They need the pinch of the consequences. But we need to make the consequences align with the severity and the frequency of the behavior, and also realize that, allow that mistakes can be made, especially with young children. So just to show you the impact that a very punitive environment can have on children, just quickly, because I know I'm running with time, is that we did this study with children in the temptation resistance paradigm, and half of the children were in this school that used corporal punishment, quite punitive corporal punishment, and another one, they did not use corporal punishment. And what we found was the children in the very punitive environment, where children were routinely beaten for transgressions, these children were more likely to lie compared to the non-corporal punishment group. And we had a Canadian comparison group here. This study was done in Togo. And we also found that not only that, these are children like 3 to 6. They're not normally very good at maintaining their lies, but the children from the corporal punishment group, children from the punitive environment, were much better at maintaining their lies. They were better liars. And if you think about it, if you're going to get into severe trouble for even minor transgressions, you might as well go for broke and lie about it to try and prevent those negatives. So what some research also with adults shows is that when you are in unjust and tyrannical environments, people are more likely to endorse lying as an appropriate, as being less bad, as being okay given the circumstances of the environment you're in. So lying may actually be an adaptive strategy to cope with harsh punitive environments. So that's something to keep in mind, that you want to be able to make sure that the consequences that you use are proportional to the crime. So it must fit the crime, like a loss of privileges or a possession, but never the loss of parental love. They should always know that your love is unconditional. They can still get in trouble for doing things, but then you're not withdrawing your love from them. So like a speeding ticket, a first offense is like a warning. They may, just be told, next time, if you do this again, there will be consequences. Later offenses may be at the ticket level, they lose a privilege or something. And then only in extreme cases would you have the go to jail card. And this is only used in very severe, serious cases, and only occasionally, and maybe never required. A parent might never have to do such a severe punishment. The other thing is to set clear rules and let them know what the expectations are. This is within a warm, supportive environment. Children need to understand what the rules are. As children get older, you can consult with them in terms of deciding certain rules that relate to them, and they have to be reasonable. But by doing that, then they also understand the framework that they can that they have to stay within and what the violation is when they do transgress. But also keeping that in mind, we need to treat them with respect and their need for autonomy. So we need to give them space. With toddlers, that's easy. Often you need to give them a choice, like, do you want this cereal or this cereal? Toddlers are seeking autonomy, so giving them a choice between 1 and 2 is one way to let them choose, right? But as children get older, we need to respect their desire for some privacy. This is a natural part of puberty. And also, as children and youth grow out, they're going more into the outside world, beyond the sphere of the family. And by giving them space, they're actually more likely to feel that they can come and talk to you. And you can still ask them about their day and know details about their whereabouts and anything related to their safety and well-being, but you don't need to demand to know everything they are doing and everything they're talking to their friends about. Teens who feel that their parents are prying too much are more likely to conceal information from their parents. Also, we don't want to teach children to be mean or brutal on their honesty. And so this is part of a framework of character building, to where we want children to learn to be brave, to be resilient, to show concern for others, to be kind, to be tolerant, to be fair, to be generous, to be compassionate, to respect others. And for this, we want to teach them these values and develop foundational skills, such as empathy, which is to understand what other people are feeling, self-control, to help us control our behavioral impulses, to delay gratification and to plan ahead, perspective taking, to notice others around us, to understand that others have different beliefs and knowledge and to understand their point of view, and conscious development, to develop a strong inner voice that helps us evaluate and decide right from wrong. And we need to teach them tact, how to be honest, but communicate in a way that is still kind and considerate of others. We don't want them to be bluntly and brutally honest so that it actually hurts people. So to conclude, research suggests that although children's lie telling emerges in the preschool years, children are not really skilled lie tellers until the later elementary school years. And with age, children become better at maintaining their lies. And this is related to children's developing cognitive abilities. And in fact, what they may emerge because of their developing the abilities that allow them to be able to understand that they can lie to others, but also at the same time are the process of socialization, which can influence children to realize the value and the importance of honesty, and that honesty is valued and important to do. And they get that through explicit and implicit messages. Implicit messages by seeing how other people behave, and explicit messages of the messages we tell them, the stories we tell, etc. The what they hear from us, the reprimands they hear from us, and basically messages and stories that show what the consequences can be for lying and telling the truth, and also model honesty, show how, because it's not an easy behavior sometimes to tell the truth. Sometimes it's hard. Show how you can be truthful. And for most, lying develops, we may go through some bumpiness as children, but for most of us, it develops so that it becomes an occasional behavior and not a persistent problem. For some, it may develop into a problem behavior. And if it is, and you're having trouble, or you're having trouble coping with it, you should seek professional help. When lying is a repeated, persistent pattern that children use consistently and frequently for a long period of time, then it may be a problem. Or when it is having a deleterious effect on the relationship between you and your child, or between the child and others. So I'll stop then. I do have this book that has a lot of the tips and tricks more expanded for you, and some other topics in there, if you're interested. And also, we do actually research related to children's truth and honesty and concealment. And some other students related to other topics like digital online engagement. So if you're interested, please, you can find my research lab at McGill University on website or Instagram, or you can always email us. So I'll stop there and see if anyone has any questions.